If you're having knee replacement surgery in the near future, one of the things that patients wonder about is whether or not they can return to running. And that's the question that I'm going to address today. Hello and welcome back. I'm Rosen, and if you have not already subscribed to the channel, please subscribe, and if you could also please take a moment and click the thumbs up like button so people like you find content like this. So close to 1 million total knee replacements are performed in the United States each year. And for a lot of patients, they want to get back to their level of activity that they did previously. If you had arthritis, you might be impacted. And one of the activities that some patients want to get back to is running. So the question is, should you, or can you, or is it safe? Now, when we walk, we put about 1.5 times body weight across our joints each step. However, when we're jogging or running, the forces can be up to 7 times body weight. So that's a lot of force, especially if you're running a few miles a couple days a week. Now, the old simple answer was if you have a knee replacement, you cannot run. Period. End of story. And even the American Academy of Orthopedic Surgery's content page actually states that excessive activity can increase the risk of loosening and pain. So it's not recommended for higher impact activities like running. Now, when I talk to my patients, one of the things that I'll tell them is, look, if you're running 3 or 4 days a week, I don't think a knee replacement is a good surgery for you because you're still active at a very high level. And at this point, even though you have arthritis, surgery probably isn't the best option. But many patients that I see have given up running, even years ago, due to pain, and they still question whether or not after knee replacement they can get back to running. Now, seriously and jokingly, what I always tell my patients after knee replacement is, look, you can run. So if a bear is chasing you, run as fast as you can. And if you're late for a flight in the airport and you need to run down the terminal, your knee is not going to fall apart. But when we're talking about running and running for exercise on a regular basis, there is concern. Now, in the knee replacement world, we have both cemented knees and press fit knees. And one of the questions that some people have is, well, if I have a cemented knee, could the cement fail when I run? And should I have a press fit knee where there's biological ingrowth? And yes, it's a great idea and a great question. I don't know of any studies that have proven the difference between one and the other, but theoretically does make sense. One study was done, though. This was presented at the Hip and Knee Society in 2020. And I thought this was a very good study to at least attempt to answer this question. So they looked at over 4,000 patients. And what they found is that in patients that run, 30% of patients expected to be able to run after joint replacement surgery. This was looking at patients that had both knee and hip replacement surgery. However, at the end of the study, only 11% of patients were able to return to running. So a lot less than what patients expected. And 30% of those that were able to return to running had pain. And what was even more concerning is that runners had a higher rate of revision surgery, one would presume due to loosening. So that's probably the best data that I can share with you. And the most important thing after knee replacement surgery, generally, for patients to have a good result, in their mind and opinion, very commonly has been patient expectations. So if you have an expectation to get back to running, just realize that not everybody can, and those that do have pain, and those that do have a higher risk of revision surgery. Now, in the future, we might have more data to give you more specifics on press fit versus cemented, age, mileage, and things like that. But at this point, the data is still pretty scarce. So at least I hope that this has answered some of the questions that you might have had about returning to running after total knee replacement surgery. Until next time, I'm Rosen. Stay safe.